So you can see in this figure, there are few numbers written, right? 1, 2, 3, 4 kore. So these are the relevant points that we need for determination of sex. This part only. So first is the diameter of the head of the femur, right? Femoral head, the diameter, anterior posterior diameter. Okay. So if we measure it, we get that in males it is larger. Okay. Males, the diameter of the head of the femur is larger than females. Okay. And it covers more than 2/3 of the sphere. Okay. So what happens is this head fits in the acetabulum, right? So while we fit it, it will occupy almost more than 2/3 of the surface area in males, whereas in female it will be less than 2/3. Okay, from the head over, clear? First is the anterior posterior diameter, it will be more in males and it will be more than 2/3 of the surface area in males. In both situation, males it will be more. Okay, now come the second one. It is called angle. Angle found by shaft with the head. Okay, neck of femur angle. This will be obtuse in, means angle will be more in males, whereas it will be acute in females. Boss. So this angle is very important. So normally if it is more than 125 degree, 125 degree and more, it is for males. 125 degree and less, it will be for females. Right? Clear? First is the anterior posterior diameter, then is the neck with the shaft angle. So more than 125 males, less than 125 females. Okay. The third one is, let's talk this one first. So this is the length, okay. So from this greater trochanter, okay, greater trochanter till the base, okay. So this is trochanteric oblique length. So it will be more in males, about 480 millimeters, okay, 450, and for females it will be like 380, okay. So in males it will be more, 450 mm for males, less than 380 for females. This trochanteric oblique length, okay, greater trochanter till the base of it. If we can measure it from the osteometric board also. Clear? Next comes third one. This is popliteal length, okay, where the linea aspera ends or divides, okay, before the bifurcation, from that point till the above the groove, till here, not till the base. Here it ends, right? Then there is a groove before the groove. From here till here, popliteal length. It is more in males as it is larger and less in females, right? Then there is bicondylar width. Okay, this width will be more in males, lesser in females. Values I will show you in the next slide. So clear about this: bicondylar width, popliteal length, trochanteric oblique length, and the angle and the diameter of the head of the femur. And this is another angulation, okay. This angle is taken from the lateral aspect. Okay, if we place it like this, there will be angle formed. Wait, I will keep it here and then you can understand. See here, I have placed this femur in the lateral aspect. There is an angle formation. right? This side. Clear? Everybody can understand? See? Everybody can see that? This forms an angle. So this angle will be acute in females, whereas in males it will be less acute. Means about 75 degree in females, whereas it is 85 degree, 80 degree in males. 75, 80. So more acute in females. And always remember, acute, mostly acute in females. Most of the dimensions, okay, except in mandible, whereas it's more acute in males and obtuse in females. Okay, so you see this angle, it is more acute in females, more acute in females. So why is it more acute? Reason behind it. Because the pelvis is roomier in females to accommodate the child. So, but still we have to maintain the balance, means the what you call posture. So, what you call to maintain the posture. Suppose if my pelvis is wider, so I have to get an angle. Okay, see, now it becomes, it has to, this will come down or will be more acute in females, whereas males the pelvis is narrower, so it will stick to the center of mass, that posture, to get the balance. Okay, bujha gelo why it is so? In females it is more like this, and in males it is more erect, right? So that forms the angle. Clear? Females it will be more like this, males it will be like this. Fine? So 125 degree, more than 125 males, less than 125 females. Okay, and here 80 and 75, 80 for males, 75 for females. Okay, so clear about this? Everybody understood what we need? Kiki chai bujhe gelo? Okay. Any doubt in this picture, regarding this picture? Those who came late, any doubt? This is anterior-posterior diameter of the head, larger in males, forms more than 2/3 of the sphere in males, less than 2/3 in females. Okay. Neck angle I just said, so I won't be repeating it again. Measurement is taken in osteometric board. That's the osteometric board. Name of it, examiner asks, you say it's Hepburn. Hepburn, Hepburn's osteometric board. Hepburn osteometric board. Fine? Okay. So these were the points we have discussed. You can just see it, what I have just told you. Right? Clear? Let's move to the next slide. Or you want to note it down. You can click a picture also, no problem. Okay. Another thing is this groove, intercondylar notch. Okay. This is wider in females. See? Intercondylar wider in females, whereas narrower in males. Other thing is that the muscular attachments, these ridges and all, this will be more prominent, where the insertion with the muscle and all, those will be more prominent in males, in all bones. Okay, except in athletes. Females can be athletes also, no? In that case, it may be more prominent. Normally in males, it is more prominent. Okay, this was the carrying angle or Q angle, sorry, not carrying angle, Q angle, that gravity and all. That's what I explained just right now. See, in females, it is more wide, as the pelvis is more wider, so it comes to more angle is formed, right? So this angle and this angle will be acuter in females, whereas in males it is more erect, right? Now coming to the age, how to estimate the age? So you can determine the sex, easy, right? Very easy. Neck of angle and angle thing and the diameter of the head and the total length and all. You can. Now coming to the age. So normally in exams the gallstone chart will be provided to you. Gallstone chart, the chart from which we calculate things. Okay. So normally in exam the chart will be provided to you. But still for classes I will just explain. So there is appearance and there is fusion. Ossification centers appear and then fuse. Right? Clear about ossification centers? So normally there are ossification center in head of femur. Primary ossification center, it is normally in the shaft, right? But secondary ossification centers, head of femur, then greater trochanter, lesser trochanter, and this lower end of femur. Okay. So appearance. Appearance is about 1 year of age. Okay. Head of femur. Both males and females. Whereas appearance of greater trochanter, it is about 5 years. Right? What is the greater trochanter 5 years. Head is 1 year, greater trochanter 5 years appearance. Then comes lesser trochanter, it is 12 to 14 years. 12 to 14 years. And lower end of femur, it may be, appearance can be just at birth or after birth. Meaning birth timing. Okay. Almost at birth or before birth. Take the birth as the baseline. Okay. Clear? Appearance clear ho gaya chhe? Now fusion. Fusion is mostly at pubertal age. You can see 14, 15, 14, 15, 14, 14, 15, 14, 15 females. Okay. So 14 to 15 years head of femur. Then 14 years is for greater trochanter. Again lesser trochanter is 14 to 15 years. Not sorry 15 years. And lower end of femur is about 14 to 17 years where variation is there. So this chart will be provided in your exams. So no need memorizing it, but you should know that such scenario exists. Clear? From this we can calculate. So in this bone everything has been fused. So what would be the age from this chart? More than? First you have to estimate whether it is male or female. So what is it? What do you think it is? What it is? Female. Okay, if you consider it as female, so what? If you consider it is a female, what would be the age? More than? More than 17. How? Female, which value is 17? This one. So it says 14 to 17 years. So there is a catch here. Whenever there is exists a variation, means 14 to 17 or a age bracket, then we take the lower value. Okay. Whenever we say it is more than, remember when I say more than, age is more than, then you take the lesser value. And whenever I say age is lesser than, then you will take the higher value. Clear? Mane, this should be in your, write it down. You write x dash x minus y, right? X to y, that's a age bracket, x to y to m dash n, x dash y to m dash n. Okay, write it down so that I don't have to explain it in each and every class. Written? X minus y to m minus y, m minus n. So the age will be between x and n. Circle x and circle n. Clear? Circle x and circle n. Clear? Now substitute those words right beneath it. More than in x and y. X and y er niche more than likho. Okay? And m and n, m dash n and niche likho less than. Clear? Now you will get your answer. Whenever there is an age bracket, whenever I say, just I asked you the question, what would be the age? So age will be more than 14 years. Clear? So this is how we will interpret. In X-rays, there will be classes. Next, there will be X-ray classes. In that also, we have to interpret. Chart we have provided, but you have to interpret, how to interpret the chart. So that formula is the base of it. Clear? Everybody understood the formula, how we calculate? X minus y, that is age bracket. Okay. Suppose it's 14 to 17. So whenever we say the age is more than, more, the word more, then we take the lesser value. And less than, then we take the higher value. Less, okay, higher value. Clear? So that's how we estimate the age. Okay, so sex has been taught, then age has been taught, we are left with stature. Stature is very easy. So studies were made on various population. Okay, studies were made on various population of various region. So few people have taken the measurement and got data from West Bengal population. Few anthropometrists have taken measurements from the Uttar Pradesh population, from north, east, west. So the data will vary from region to region. So we are more focused on in this region, that is West Bengal. So we follow gallstone chart. Okay. So Pan was also anthropometrist. He calculated, means took the data from the West Bengal population and then he got a multiplication factor. Okay. So if we multiply this, then we can calculate the stature. So what he did was, he got the formula. That's a very big part, but we are not interested in that. We just are interested in the multiplication factor. So first we will measure the bone by putting it in osteometric board, and then we multiply it. So for males it will be 3.82 and for females it will be 3.08. 3.08. Okay. So this is the multiplication factor from which we can estimate the stature. So this is an approximate measurement. There will be some plus or minus 2, something like that, from the actual age, actual height. What is stature, you understood, right? Height of the person. Okay. So the table, this multiplication factor is valued for Bengal, Odisha and Bihar population. And there are others also for Nath, NAT for UP population. And Siddiqui in Shaw, there are multiplication factor for Punjabi population. Okay. You have to remember these two names also, Trotter and Jessler and Carl Pearson. These are international, means here they have got the multiplication factors for the international population, like Europeans and what do you call, Africans and all. Okay, so these two names are important. Trotter and Gessler and Carl Pearson. This might be asked in your exams, like in Viva, tell how you calculate the stature from long bones. So you have to state that from PAN, that the multiplication factor is 3.82 for males and females. The second question might come, what else, what other charts do you know? So you can state all this, that Nath from UP and Shaw and Siddiqui from Punjabi population, and Trotter and Gessler and Carl Pearson. These are other, they have got their multiplication factors. Okay, names are important. But the first one you have to remember, that a multiplication factor 3.8 and 3.08. That's from PAN, because you have to calculate the stature. Bone is available with us. So if it in exam, if it comes, you have to. Okay. So stature over. Now what is left? Findings and opinion. How to write opinion? Check. Write it down. For every bone, most of the bones, you have to write the opinion in this format. Okay. Each and every word is important. So what I said earlier, above or more, and below or less, right? Those are synonyms. Exam you write above, okay? Don't write more and less. Above and below. So above is more and below is less. Exam you write above and below. Clear? Date and time of examination at the time of your exam only. Whatever the date is and time it is, you should mention. Not write here, not write here, but in exam you have to write. Okay? So that completes our femur. Clear? Now we'll move to next topic, that is dentition. Dant. So what we'll learn from teeth. So application of dentition knowledge, that's what I am going to teach you now. This will be very helpful in estimating the age from the mandible, as well as estimating the age from the skull also. Okay. Maxillary part hai to daant hai, socket thake to skull hai. So there also you can calculate the age. So that's why we have to know how to calculate the age from teeth. Teeth. Daant. Okay. Everybody has teeth. So teeth is divided into three parts: crown, neck and root. Crown, neck and root. Okay. So that's also divided like, where is enamel? Enamel is the protective layer. Shabtheke upor dike thake, very strong layer. Okay, it's more prominent in permanent teeth. And there is dentin and pulp cavity. Anyway, this is the anatomy. Just have a look at it. The more important thing is coming. How to estimate the age. Fine? Clear with the anatomy? This also is not so important. This is from embryology and all. Okay, this is also, okay, any teeth has surfaces. Okay. Suppose these teeth, okay. So this is one surface outside. This is called occlusal surface. Okay, this way. facing whatever the surface is outside. Then there is inside, means this portion. This should be lingual surface, where because the tongue is in lingua. Okay, so the inside one is lingual surface, occlusal surface, lingual surface, and there is distal and mesial. Mesial means this, if you take this as midline, whatever the surface is facing the mid side, this side, okay, that will be mesial surface, and whatever is facing distally, so that will be distal surface. Okay. Occlusal is that is facing outside, means towards your outside the cavity, occlusal. Lingual is that is in contact with the tongue, lingual surface. And there is mesial and distal. Mesial is that is facing the midline. Okay? This is, if this is midline, these surfaces will be mesial surface, and the other one is distal, that will be facing distal side. Okay. What would be this surface? Occlusal, right? What would be this one? This side, distal. Okay. What would be this one? Mesial. Clear? Now this one, canine. Okay. What is this surface? Occlusal. This one, this side, mesial. Right? Okay. Now coming to main part, temporary teeth and permanent teeth. Temporary মানে কি? Milk teeth, right? Milk teeth. বাচ্চাদের হয়. So normally there are 20 number in 20 number of teeth, that is temporary or milk teeth. Okay, whereas in adults it is 32, right? So each jaw will be having 10 number of temporary teeth in kids or children. 10 plus 10, 20. Whereas in permanent one, adults it would be 16, 16. 16 in each jaw, means lower jaw 16 and upper jaw 16, 32, right? Clear? So what has changed? Which teeth are added? Added teeth. Added teeth are super added teeth. Remember, I told added. So just add super. Behind the added, it becomes super added. So what are super added teeth? Mane adults, there will be how many teeth more? 3 plus 3, 6 into 2, 12. 12 teeth are added. That are super added teeth. So what are those super added teeth? Molars, permanent molars. So each jaw has 6 super added teeth. Permanent molars. Molar 1, molar 2, molar 3. Right? So this side 3, this side 3. 6, upper 3, and here. Total 12. So 12 super added teeth in whole, as a whole. So the name super added. Okay, super added means they have been added. They didn't have any thing to replace. They just erupted. Okay. They just erupted. Clear? Adults, super added teeth are the molars. That is the catch point, molars. So how many molars? 12 molars. Right? So 12 molars, right? 4 3 is 12, right? 12 molars, they are superadded teeth. Superadded. They didn't have their ancestor. Who are their ancestor? Milk teeth. Or so clear? Superadded teeth. Okay. So dental formula 2102. So what does that mean? 2102 is from one half of the jaw, only this portion, not the whole. If you divide it in 4 quadrants, one of the quadrant, 4 quadrant means like this. Okay. So only this portion. Okay. So only this portion, not the whole one. From the center midline to the this one, there will be 2102 for children's. 2 incisors, 1 canine, and 0 is premolar. Okay, and they have molars. How many? 2 molars. So what they don't have is premolar. Clear? Okay. Up till now it's clear, right? So what happens is the 2 molars of the children. 2 molars of the children. You said no, 2 molars were there. If they fall off, they will fall off. So in their place, what rises up? Molars fall off. In place of this 2 molars of children, what will rise? 2 premolars of adult. Okay. 2 premolars of adult will rise in place of the molars of the children. Okay. So they had ancestor. So only those molars, they didn't have molars of the adult. They didn't have ancestor. That is, nobody was there. They did not replace anybody. Clear? This is the logic. Very important. Okay. 2102, 2123. 2123 is 2 incisors, 1 canine, 2 premolar and 3 molars for adults. So now in this formula we have to know the age bracket, which teeth erupts when. Then only we can calculate the age, right? We have to know in means normally, usually, which appears when. There are scenarios where it will be means the eruption will take place earlier or the eruption may be delayed. But we are not bothered about those extremes. We will take the median, means in average what we get. So we will see this chart. This is clear? See here. Very important chart. So normally, is there any application? Does it apply? Means, do we need to know this? What is the use of it? Yes, there is a use of it to estimate the age, and it is very frequently used. In exam also, it is frequently asked. Suppose you get a bone like a skull, they will ask you to examine the age, find the age. So you have your application. If you get a mandible, you have application. You have to tell the age. In a real life scenario also, if there are bodies, unclaimed bodies of children, where we can estimate the age from counting the teeth. Okay, so there are means there is use. In case of what you call multiple dead bodies, means in like train, what you call mass disaster. Also there we use these things. Dentition also. Dentition. Even why teeth are important in unclaimed dead bodies. So in unclaimed dead bodies, যেগুলো postmortem এ আসে, we normally keep the teeth. We preserve the teeth. For what? Why do we preserve teeth? We dispose the body, but we still preserve the teeth? For not for age determination. We can get DNA. Okay. So later on we can match it. So we preserve the molar teeth in unclaimed dead bodies. So teeth has a very important role in forensics. And this is not normally being done. Bite marks also. From the bite marks we can find the accused who did it. We can match if somebody is accused that he assaulted somebody. So the police can measure the bite marks and match it with the dentation pattern of that accused. Okay. So it has fallacy, but it was sometimes used, and it is used. So these are the important implications or use of it. So in this chart, temporary teeth. Okay, these are when the teeth erupts, and the bottom one is for permanent teeth. Very easy to remember if you want to remember. See here. These are C is for incision, central incision, and L is for lateral. So CI and LI is central incision, lateral incision. Then it is upper and lower. Okay. We have taken half of the jaw. One half of the jaw means in this formula. We have taken only this part. Okay. Clear? That is here. That it is this part of it. Half of the jaw of one side, or not one side, both side. Half of the jaw of the both side, maxillary and mandibular. So these are upper teeth and these are lower teeth, right? So what would be the age of eruption of temporary teeth? Very simple to memorize. I will show you how. 6 months, 6 is for months, okay. 6 months, 7 months, this would be 8, okay. 9, no problem, and 10. 6, 7, 9, 10. This order, okay. Very easy to know. Central incision, lower area erupts first, then the upper, then the lateral, this way. 6, 7, 9, 10. Leave this portion, okay. Again come here. First molar of baby, these children, okay, temporary teeth. 12 months, this is 24 months or 2 years. Easy remembering, and this will be 18 months, canine. 6, 7, 8, 10, here it is 9, it's okay, 9, you can take 9 also. 6, 7, 8, 10, and then 12, 24. And canines at 18 months. These are all in months. Eruption. How to remember? 6, 7, 9, 10, leave the 18 alone, go to the molars, 12, 24. Then come back again 18. Clear? This is for temporary teeth eruption. Right? So, now coming to mixed dentition. Mixed dentition means ki it is the period in which the milk teeth falls and the permanent teeth erupts also. It is about 6 to 11 years of age. 6 to 11. 6 years to 11 years is the age of mixed dentition. Very important. Note it down. Examiner will ask you what is the period of mixed dentition. So you should state it is 6 to 11 years. Clear? Six to 11 years. Very important. The examiner will ask you. So what happens is few of the teeth will fall. Milk teeth pode jabe, dudher dant pode jabe. Milk teeth will fall, and in that place the permanent teeth will erupt. So in this period the total number of teeth will be 24. Mixed dentition, number of teeth during this 6 to 11 years of age will be 24. ঠিক আছে? So 24 teeth কখন থাকে? So suppose in a question there were, if it is mentioned the total number of teeth were present was about 24 years, and other parameters will also be there that would support 6 to 11 years of age group. So that is the period of mixed dentition, 6 to 11 years. Okay, 6 to 11 years, very important. 6 to 11 years. Now coming to permanent teeth. So permanent teeth, what is the first permanent teeth to erupt? That's also a question. First permanent teeth to erupt is first molar. First molar. Right? 6 years of age. First molar. So oldest teeth in your mouth is first molar. Oldest teeth in your mouth. Okay, you are now adults, right? Not children. So this would be your first molar. Clear? So this is also very easy to remember. 7, 8, okay, 7, 8, 9, 10. Leave the canines. Canines, just forget, there are no canines, just leave this. 7, 8, 9, 10. Then comes canine, 11. How will you remember canines 11? It is like sharp pointed. Says I am 11, I am 11, 1, 1, 11, 11. Go downside also. Okay, 11. Canines 11 years. 7, 8, 9, 10, then 11 years canine. Clear? Very easy to remember. Now coming to the molar part. 6 years, you doubled it, it becomes 12 years. You double it, not double it, you add 6 to it. 6 plus 6, 12, 12 plus 6, 18. Okay. Clear? 6 years, 12 years, 18 years. 18, normally we write 18, but it is 17 to 25. It's the age bracket for eruption of third molar. Very important medico-legally. Third molar 17 to 25. Here we have, for making things easier, I have mentioned it is 18. Anyway, that's 18 is also okay, but it is 17 to 25. Clear? If you know this chart, you can easily determine the age. Nothing is left out, right? This is what we need. Okay. The rest, whatever I teach you, is for academic purpose, that is for mostly for your exams. Means how to calculate the age beyond 25 years. So this, from these values we can get the value up till 18 or 25 years of age. So beyond 25 years, how will we estimate the age from it? Then comes a method known as Gustafson's method for estimating the age. Gustafson's method. This chart is clear for everybody? Anything that is I missed out? No? Everything I've covered, right? Okay, these things you know, just I have taught. Nothing is there. Okay. Premolar. How many? 2 in each quadrant, right? 2, 1, 2, 3. So 2 premolar in each quadrant. Quadrant means if you divide it a line here and another line here, so this is one quadrant, this is one quadrant, this is one quadrant, and this is 4 quadrants are there. Okay. So one quadrant will be having 2 premolars. These premolars are also called as bicuspids because it has 2 cusps. Okay. Homework is you go and see what is cusp and all. Okay. Or the morphology of teeth. Cusps are found in 2 cusps. Bicuspid is for premolars. Then another question examiner will ask you is where do you find cusp of Caribelli? Caribelli. Caribelli. So it's found in Caucasian, that is for race determination. Okay, Caucasians, premolar, Caribelli, Caucasians, premolar, CCC. Okay, cusp of Caribelli in Caucasians for race determination. There is an extra cusp that is known as cusp of Caribelli. That I have taught you in determination of a race class. If you were present, you must have heard of it. Okay, let's finish this off. So bicuspids are premolars. Clear? Right. Two cusps. Now we have to differentiate between permanent teeth and temporary teeth. So you will find that in any books. Normally temporary teeth will be smaller in size. It will have temporary teeth I am talking. It will be smaller in size. It will have chalky white in appearance. Then they will be what do you call? What else is there? Okay, regarding that also, size is smaller in temporary teeth, but there is an exception. What is the exception? The molar teeth of the children, that is larger. That is being replaced by premolars of the adults. So that's one exception, that is larger. Okay, molars. So other things you can go through the literature. This doesn't need much explanation, but memorizing. Okay? So this you can find in any book. Difference between temporary teeth and permanent teeth. Okay, these are all shapes and all. Okay. Age estimation beyond 25 years. Age estimation beyond 25 years is by Gustafsson method. Okay. So what are the parameters we need for estimation of age from Gustafsson's method? It is very important. That's also a question. Where Gustafsson's method is applicable? It is applicable on the people whose teeth are beyond 25 years of age. Before that, we can, by counting the teeth, we can know the age. But after that, this plays a role. Okay. Let's see here. First criteria is attrition. Then there is periodontosis. Then there is secondary dentin. Then there is apposition, cementum apposition. Then there is translucency, and then there is root resorption. So among this, the most important one for estimation of age, most important is translucency of the root. This is the most important criteria. Okay, translucency. Just mark a start and write MIMP, most important. Translucency. Okay. Others you should know: attrition, periodontosis, secondary dentin formation, root resorption, and cementum apposition and translucency. 1, 2, 3, 4, 5, 6. 6 criteria. Okay. Yeah. You wrote this down? So, by the wear and tear and all, cementum deposition, we just give a grading like things: A0, A1, A2, A3. This, it will not be asked in your exams also, but for for your knowledge, I will just cover it very fast. If you have we don't have time also. It's already 3. So I will just make it faster. So by wear and tear and all, there will be grading. Okay, for attrition, A1, A2, A3. For periodontosis, it will be P0, P1, P2, P3. For dentin formation, S1, S0, S1, S2, S3. From that, we get a value, and from that we multiply it and add this one. See here, all those values we multiply, and we'll get the age. Okay, we add and multiply. So this is what we do. We calculate the age from. So it won't be possible for you to calculate it in your exams also. So it won't be asked, but still there is a formula called as Gustafson's method, and they have these parameters. Which parameters I just told you, you should know that. If anybody asks you about Gustafson's method, you just say it is for age beyond 25 years of age, and it has these parameters called as attrition, periodontosis, secondary dentin formation, root resorption, cementum apposition, and that translucency. Among them, the most important criteria is translucency. That is a very important question. In multiple MCQs everywhere, there will be question which is the most important among them is the best. So you should answer that translucency, okay, because it gets the good value from it. So it's easier also. So that from that we get these values, and then we put it in formula, and then we get a estimated age that will also vary by about 7.5 years. Okay, so here what is it? Plus or minus 7.5 years. Fine, error will be there. So again, coming to charting, you should know few names, charts, few chart name egulo rakhte hobe. So we count the teeth. There is an order for counting the teeth or knowing which teeth you are talking about. So in case of like dentist ki kore daat tole to. So they have to write also, no, in prescription which teeth is affected. So they can have this Sigmondi dental notation, then there is FDI, and there is Palmer notation. Okay, so all dentists around the world follow different means reading the teeth. Okay, so here you see it is like right and left, and they have used Roman numericals. This is for Sigmondi. Okay, that is for temporary, whereas permanent they have used these numbers 1, 2, 3, 4, 5, 6, 7, 8. This 88 means is 8 মানে কি হবে তাহলে এটা what teeth would this mean? So this is midline. Okay, as I told you, quadrant. So these are normally the central teeth. These 1, 2, 3 will be 1, 2 will be first will be central incisor, second is lateral incisor, third will be canine, 4, 5 will be premolar, and this will be molars. Clear? So if somebody mentions is like 8, this if they indicate, so they have to indicate like this. Okay, they will put an angle. This one is upper quadrant. Okay, this one is lower quadrant. This one is not upper quadrant, left side, right side, and these are lowers. Okay, so they will just put a value over it. So this, if I write 7, so that will depict this one, right 7. Okay, এখানে একটা 7 লিখে দিলাম. If I write 2 here, that means it is of 2 this side. Okay, this is for permanent teeth. Now in the same way, if I write Roman numbers, that will indicate temporary teeth. Clear? Understood? This is sigmoid. Clear? So similarly, there is Palmer's notation. Normally we use modified Palmer's notation, but Palmer's notation is also okay. Here also same, we have numbered right, left, and then we put numbers according to the teeth. These are for permanent teeth. Primary teeth means the milk teeth will be A, B, C, D. So you can use like that, but you have to follow anyone. Okay, this is clear? This is modified FDI. Here what happened is, they thought that the previous one can be mistaken of, so they changed it into totally numbers. Okay, for permanent teeth it starts with 11. Okay, 11, 12, 13, 14, 15, 16, 18, and from this side it is 21, 21, 22, 23, 24. So 1, 2, 3, 4, and there will be 1, 2, 3, 4, 5, 6, 7, 8, 1, 2, 3, 4, 5, 6, 7, 8. So this is one way of writing the which teeth, counting teeth. Okay, that is modified FDI. This is for permanent. For temporary also, they start from 5, 6, 7, 8 and they are add numbers. Okay, clear? So normally you have to, in exam they may ask you what are the methods. So you should know the names. Modified FDI, then Palmer's notation and that Sigmundis. Okay, clear? You have to know the name, and in special scenario one might ask which one is which one. Those very intelligent people can recall it and tell to their examiners. But expected is you at least know the names. Exam you might get confused. Okay. Anyway, you know that these are there. If you have time, you should learn.